Hi everyone and welcome to week 5. This week we're going to talk about communication and political competence. The communication piece specifically will be talking about patient experience and patient satisfaction. But first of all, I want to thank you for the awesome discussions and papers last week on special interest groups. I know that I learned as much as you guys did. You really outdid yourselves. There was a lot of great discussion about many different kinds of special interest groups and what they have to do with healthcare and what they have to do with nursing, and a lot of good ideas and insights about joining our professional organizations and getting more active in the politics of nursing, which is kind of what this week is about, the political competence piece. But again, thanks for the great discussions. You really did a good job. I wanted to just ask you if you thought that there was a difference between patient satisfaction and patient experience. When you're at work, at any of meetings or committees that you may go to, or if your nurse manager or supervisor is speaking of this, do they refer to it as patient satisfaction or patient experience? I subscribe to a couple of different blogs through my LinkedIn account. And again, it's a nice way to be informed if you do have a LinkedIn account. There are many different blogs and many different interests that you can subscribe to. I belong to different groups for hospital associations, for nursing associations, for faculty, things like that. So it's a really good way to keep up on things. But one guy, it was one of the hospital groups that I belong to, put this little chart up showing the difference between patient satisfaction and patient experience, because there really is a difference. Patient satisfaction basically is one-dimensional, usually meaning that the hospital performance is measured through one survey. The patient experience is a little more holistic. The focus of patient satisfaction is usually meeting the clinician or manager's agenda, while the patient experience measurement are issues that are more important to patients. The patient experience measure tends to really focus more on the hospital experience, and the patient satisfaction measurement is more subjective. And so they think overall that the patient experience measurement is less biased. It'd be interesting to see what most of you say your hospital is concerned about or your hospital is measuring at this point. And then lastly, have you ever looked at your facility scores on HCAPs? I bet you probably have. As part of just being in this RN to BS program, you've probably had assignments to look on it before. You know that you can look at the HCAPs, or the patient satisfaction scores, all of the different core measurements, and you know that anybody with a computer and an internet can do the same thing. So if you haven't, I encourage you to do so. Look at the kind of questions that are asked. And by the way, does every hospital use the same survey? I know that there are different surveys that some people use out there. There had been different surveys called Picker surveys or Press-Ganey surveys. But anyways, the questions sometimes are just worded a little bit different. But take a look at those. You can compare your hospital to hospitals around this area, to the Massachusetts state average, and then also to the national average, and just see how you're scoring. And as somebody already wrote in this week's discussion, the hospitals are actually being penalized. Part of their Medicaid and Medicare financial reimbursement is withheld according to their HCAP scores. So I'm sure everybody can see how important these scores are for hospitals and their employees. So again, I look forward to looking at the discussion and in joining in the discussion this week on patient satisfaction, and I really look forward to seeing your PowerPoints. So I put a little announcement on earlier yesterday or the day before explaining a bit about those PowerPoint assignments. If you have any questions, again, please let me know. Email me through the BayPath email or email me through Canvas. And I look forward to seeing you online. Bye.